this is a very important point in relation to what I just mentioned. Whether you are adopting the PBL proper or the PPL problem solving, there are different types of problems that are suitable for different types of PBL. Now, in Maastricht, they identified 6 or 7 types. I'm going to discuss with you the 6 major types of problems, and this is a list of problems. The first one is called the explanation problem. The second one is called the discussion problem. The third one is called the study problem. Then the application problem, and this is very clearly used in the problem solving. It is called like that, problem solving problem. And then we have a strategy problem, and then we have a multi-level or multi-system problem. So that we have 6 types. If you look at them, you will very clearly identify that the first 3 are used early, and the second 3 are used later in the curriculum. But that doesn't mean application problems, the problem solving, cannot also be used early. If you have just a soft type of problem and you ask the students to actually try to solve the problem, it will be an application problem or a problem solving type. So we have 6 types. I will give just a few words about each of these types. Now, the explanation problem, students explain and understand underlying structures and mechanisms. So this is very clear, a type which can be used for basic sciences, because through the problem, the students try to understand underlying structures, underlying mechanisms, and then they are able to explain them. So this is called the explanation problem, and this is usually mostly used in years 1 and 2, and they focus on normal human function and structure. So, for example, if I give a problem to the students about a patient with edema or ascites or whatever, and then I ask them to explain how this abdomen became large, or how do this feet became swollen. So I give them a problem, and through that they will try to explain a feature of the problem using basic sciences or basic features. The second one is the discussion problem, and this can be used to foster understanding of different points of view. So the discussion problem, although it's very good for the discussion of aspects of the problem, but it fosters the discussion of different points of view, not knowledge. So students learn to reflect critically on the standards and values of the medical profession, for example, and then they are stimulated to think about topics connected with healthcare and develop well-founded personal standpoint. And these, for example, are very good to use with ethics and professionalism courses, because you need to formulate your own standpoints and attitudes. Now, students are not expected to come up with solutions to the problem, and usually, as you know, ethics problems are usually ethical dilemmas with no clear answer. Now, the third type of problem is called the study problem. Now, the study problem, students, we just want them to independently study a particular subject. So we are going to remove some subjects of our curriculum and then ask the students to go through a problem, and you focus on a fact that through this problem, the students are going to go and study the nerve supply of the gastrointestinal tract. So a study problem is concluded by a concrete assignment to the study specified topics. So when we discuss the process, we will shed light on how you make concrete assignments to study specified topics. Now, the fourth type is called the problem solving type or the application type. Now, the application type requires previously acquired knowledge And this is applied in a simulated practice situation using assignments. So this is called the application, and in which case it can be certain whether students have truly mastered knowledge. So mastered is a key word here. It is you make sure that the students master the knowledge by asking them to actually apply the knowledge to a situation, and in that situation they apply and try to solve the problem. The students must apply their knowledge in an integrated manner, and then the knowledge is reinforced when it is applied. Now, the strategy problem is used later because the purpose of the strategy problem, students learn rational clinical reasoning and decision making. So as you know, this is started early and it is reinforced and mastered later in the curriculum. So it is good to start the strategy problems early, but we use them more towards the end of the curriculum. Now, it's usually based on knowledge and understanding of underlying processes. This problem addresses strategy and decision-making skills rather than the explanation of underlying pathophysiological processes, which is done in using other types of problems. The last problem is because healthcare practitioners, different types of practitioners, are usually faced by multi-level, multi-system, complicated problems. So this is usually used later, and these problems present detailed patient history, starting with the presentation of the complaint up to including the treatment and follow-up. So these are usually used later in the curriculum. Disease history is presented to the learners in phases. This multi-level, multi-system problem is usually addressed in many weeks, not 1 week. They give them part of the problem and they work through the part of the problem, and later on they work on another one. So each consecutive phase is accompanied by additional information about the patient, which is presented to the group. Now, this is used for in-depth study of pathophysiological problems. So to end up with this part of the presentation, we have 6 types of problems, and these are the study problem. No, first there is the explanation problem, a discussion problem, study problem, application problem, strategy problem, and multi-level, multi-system problem. You need to select the type which is quite suitable for the group, for the stage, for the level, and for the place in the curriculum. Now, sorry, I need to stop this and just animation, fade and play again. Now, do we need to design cases? Now, these types of problems, 6 types, etc., do we need to design these cases? Actually, thousands of cases are available. You don't need to design them. If you would like to design, okay, no problem. You can read about how people do design. But it is easier to get some of the problems published in books. And then some are also found online. And we in Al-Marifa, we are in the process of designing a digital resources library. Part of the library will be a clearinghouse repository as part of the digital resources library. So we will provide you with thousands of cases, but you need to go through the cases and you need to adapt and customize. And there is one, there is more than one, but Delaware University have their clearinghouse repository, and actually they are offering them for everybody to use. So we are going to include them in our digital resources library. And but these scenarios, whether they are found in books or found online or found in a repository, these might need some customization and adaptation, and later on we will have a workshop on how to customize and adapt cases. And the meaning means to customize them and make them suitable for the level of your students, suitable for the culture, suitable for the so different. So there is cultural customization or adaptation. There is academic or educational customization and other. So you need to pick some of these cases and adapt them to your need. As you can see, many books. There are many books. Let me just very quickly take you in a very quick 2-3 minutes journey. Every type of high risk obstetrics case files, internal medicine, case file, orthopedic surgery, case files in biochemistry, anesthesiology, critical care, family medicine, neurology, emergency pharmacology, gynecology, neurology, acute care. As you can see, there are hundreds of books with thousands of cases. Hundreds of books with thousands of cases. So you don't need to worry. Also, for example, this is one of the books that I like very much. It is called Pharmacotherapy Casebook, a patient-focused approach. And in this book, you have many cases, and those cases are well written. For example, in SAID induced ulcer disease, detailed, including the learning objectives. So you do not need even to write learning objectives; they are already there. And then this is a presentation. This is, and you can select. And when I said you can adapt, you can adapt. You don't need to take everything, but you can take whatever suits your level, your students, your objectives. So you can select from this case, and then even the questions you use to stimulate students to learn are included. So if you take, for example, this book, it's fantastic. It gives you everything. It gives you even the aspects to be discussed by the teacher or to be in, and further references. So as you can see, each case, stress ulcer prophylaxis, upper GIT hemorrhage, and then 1, 2, 3, 4, 5 pages, 6 pages, 7 pages. 7 pages, you can use them to prepare your problem-based learning sessions. Now, this is the Delaware's University of Delaware Problem-Based Learning Clearinghouse. And this clearinghouse, let me click and show you. The clearinghouse includes, for them, it's for the university. And it's, as you can see, it is classified into disciplines. And then you can select any of the disciplines. Just a minute. Let me go right there. Okay. This is the clearinghouse, as you can see. For example, biological sciences, I will click on biological sciences. We have biological sciences, we have nutrition, biotechnology, faculty development, and there are some multidisciplinary. And then, for example, this is the level, and then you can straight download these cases because they are offering them for you to download. So you can download the case straight away. And these are the different cases. As you can see, this is level for the advanced, 8 cases. For the intermediate, 2 cases. For the introductory, 2 cases. Introductory non-majors, 1 case, and so on. So intermediate, etc. So it is giving you a list of cases in the field, and you can go straight. Is pitching career over, homecoming, etc., harvest. These are the title of the cases, And from here, you can download the case and use this for your teaching or for your curriculum. Okay, so this is this, and then let me continue with my PowerPoint. Okay, this is the first part of my session, which is about what and why. Now I will give you, say, 5 minutes to ask questions or add any comment. I will stop sharing. Okay, any questions or comments, please, on the what is PBL and why PBL? No questions, no problem. The second part is about the process, how it is done. Now we know what it is and know why. Sorry, not how it is done. Why? Why go for problem-based learning? And then we take it from there. So the second part is why. Now, why do it? What is the reason that people are advocating the use of problem-based learning? Actually, there are 3 different aspects to this question. The first one is related to adult learning, how adults learn. The second is what are the roles of the graduate when they graduate? What are their roles? So we need to address that issue. And the third one, there is evidence that identified new approaches or modern approaches in teaching and learning. So these are three issues that might explain why people advocate the use of problem-based learning. We started the first one, adult learning. Many research, many papers, many literature found that adults learn and return information better when they are actively involved in the learning process. If you passively transfer the knowledge to them, they do not learn as well as they learn when they are actively involved. And this is why we are also advocating active learning in general. So this is one aspect, this because adults learn when they are actively involved. Also, they learn better and retain better when they learn, what they learn is relevant to the future roles. So you need to link what they learn to what they are going to do in the future. The third thing, when they appreciate, because some students do not take certain aspects of learning seriously, if they do not appreciate that this learning is important to them. So appreciation can be done through problem. Problem-based learning takes these 3 principles into consideration. These principles of adult learning are all taken care of through problem-based learning. So this is the first, and this is, you find these adult learning principles everywhere. And if you look at them, you will identify that through problem-based learning. If the adult learning principles, they learn when they are problem-oriented, they are goal-oriented, and they have previous experience they would like to apply, and they are internally motivated, and they are ready to learn. They are through their learning experience in the past, and they are self-directed. So these principles of adult learning actually advocate, or let us think more about using problem-based learning. So putting adult learning principles to work, this is one of the issues of problem-based learning. Now, the second issue related to this is the roles of the graduate. All healthcare professionals work with patients, and when they do, they need knowledge and skills that help them understand the patient's problem. So this process of understanding need to be used early in their learning program. So you need to understand activities which move them from just rote learning and memorization into trying to understand the features of patients' problems. Now, also, mostly basic sciences are needed to understand the patient problem. And when I say basic, it's not just anatomy, physiology, biochemistry, but also pharmacology, pathology, and microbiology, and pathophysiology, etc. So these basic sciences are necessary for the understanding, so you need to introduce them into the curriculum through problems. Also, they need the knowledge and skills that help them manage the patient's problem. And this is done mainly during the learning of clinical or medical science. Now, using the PBL will help these learners appreciate the relevance of what they learn to the understanding and management of the future understanding and management of patients' problems. Now, the third aspect of why this modern approach is used in medical curriculum, in the medical or health professional curriculum, which emphasize student-centered self-directed learning and problem-based learning, integration, structured learning, and PBL, which is one of them. There are four, but one of them is problem-based learning. But problem-based learning is also student-centered and self-directed, and it uses integration. And it is usually structured, or the curriculum is usually structured when it uses problem-based learning. So all of the other approaches, other than problem-based learning, are helped by the use of problems. So applying these problems will stimulate all these four approaches. So as you probably know, the major approaches in healthcare professions education published by Professor Hardin in 1984. He mentioned 6 major approaches in healthcare professions education, starting from student-centeredness versus teacher-centeredness, problem-based learning versus subject-based, integrated versus discipline-based, community-based versus hospital-based, continuing postgraduate education. This is an added one, and elective standard program and the systematic approach. So these major six are published by Hardin in what he called the SPICES model of the healthcare professions or medical education. If you remember, the two major definitions were published in 1983 and 1985, and this paper published by Hardin was published in 1984. So in that era, starting 1983 to 1985, the issue of problem-based learning arose to the surface. Now, so you need to move from teacher-centered to student-centered, from information-oriented to problem-based, from subject-based to integrated, from college-based to community-based, from uniform to elective-driven, and from opportunistic to systematic. And this is why you need to use problem-based learning. Now, Al-Maarifa University strategic goals and initiatives included very clearly this issue, and they have Al-Maarifa University strategic plan has a number of strategic goals, and developing a student self-learning process and intensifying case studies is one of the initiatives. So this is done at very different levels in the strategy. First, they started through the revision of the common graduate attributes, education center and quality centered work through a small project to revise and refine the common graduate attributes, and then adoption of methodologies to facilitate their acquisition and mastery. So we revised the common graduate attributes, including include leadership, teamwork, communication, etc., and critical thinking. And these common graduate attributes, we need to adopt methodologies that facilitate their acquisition and mastery. So the integration of case-based learning also is started as part of this strategic goal and initiative. And as you can see it here in the strategic objective number 2, which says create an attractive and competitive learning environment. And actually, one of them is supporting the continuous development of academic programs and then raising academic and professional performance of the student. And in this strategic goal, you have there developing student self-learning process and intensifying case studies. So this is already written in the strategic plan and it's already started. And so problem-based learning is now a strategic direction as it is now called.
Excuse me, sir. Sorry for interrupting in between.
Yes, please.
I just want to know whether you are sharing the screen because we are not seeing the screen, only we are seeing your video.
Oh. I thought I was sharing. Sorry for that. You should have. But I think, let me just do this.
Yeah, it's visible now.
It's visible now. Okay, let me just go through the slides very quickly because you already heard what I wanted to say. But you can start thinking about questions if you like while I go through the slides very quickly. And then you can ask the why about why. So why I said adult learning, roles of the graduate and modern approaches. These are the 3 justifications. And for adult learning, these are the principles, the 3 principles. They learn better when they are actively involved. They learn better when what is learning is relevant to the future and when they appreciate the need. And that can be done through a problem-based learning. And this is actually the adult learning principles: problem orientation, experiential learning, internal motivation, and readiness for learning and self-direction. These are the principles of how adults learn, and these can be achieved through putting these adult learning principles to work, through problem-based learning. The second thing, the roles of the graduate, because they work with patients, and they need to understand their problem, and they need to manage their problem. And these 2 give relevance to the students, and this is why they learn better when they learn through problems. Now, finally, is the modern learning approaches in medical curricula or healthcare professionals now emphasize student-centeredness, problem-based learning, integration, and structuring of learning. And these 4, one of them is problem-based learning. The other 3 are helped by problem-based learning. And as you can see there, the move now is from these old approaches to the new innovative approaches. So you need to move from teacher-centered to student-centered, from information to problem, from subject to integrated, from college to community, from uniform to introduce electives, and from just opportunistic learning to systematic structured learning. Now, about Al-Ma'rifa, this is very important. One of the strategic objectives, this is a strategic objective, and this is a goal. And there we have this initiative or project, developing student self-learning process and intensifying case studies. This is the rationale or justification of why we need to use problem-based learning. So any questions so far before we move to the process?
Prof, I have maybe I would ask you to make a comment on a problem, you call it problem-based learning and evidence-based learning. Can you make a comment on that?
Pardon, I don't. You want to comment, or you want me to?
I want you to comment on it. Evidence-based practice and what we call problem-based learning. Just make a comment if you don't mind, please.
Okay, no problem. Of course, evidence-based practice as it's a concept. It's a concept that was introduced in 1995, and we need to actually include it in our teaching and learning. So that is one aspect. So evidence-based as a concept needs to be introduced, and when it is introduced, the most suitable learning approach for evidence-based practice is problem-based learning, because actually they use papers, they critique papers, and those papers are usually papers addressing diagnostic test, papers addressing therapy, papers addressing pathophysiology. So whatever papers are used for evidence-based medicine, the best way to include them in your curriculum is through problem-based learning. So they are integrated, problem-based learning and evidence-based practice.
Thank you.
Thank you. Okay, lastly, but not least, of course, how it is
Assalamu alaikum.
done. Yes, Abdurrahman.
Assalamu alaikum, bro.
Wa alaikum
Thank
salam.
you. Thank you for a very nice presentation. Just if you give me 1 minute to share my experience when I was a teaching assistant 10 years ago, I was a demonstrator of problem-based learning. In fact, one of most effective learning method approach can be conducted to the student. But I think so. Um, يعني 50% for success this approach, the culture and the uh, our perception regarding to learning. Just I would like to ask about the challenging may face the problem-based learning in implementation, especially in our situation. Yani. What do you expect?
Thank you very much. Sorry for this. Now, if I can give you a short list, because it's a linked list, it's a long list of challenges. Challenges doesn't mean, doesn't make it impossible, but you need to
Yeah.
identify them and address them. Thank you very much for raising the issue. Now, the three major ones, one is the venue, the venue. So because you need to divide your students into smaller groups. Now, for example, the smaller group you are using now in sections is around 20, 25. And what is advocated for problem-based learning is 10 to maximum 12 students. So they say 8 to 12, but say 12 students. So you need to further divide your smaller section, your group into smaller groups. This is one. So venues, this is number one. You need to have space where you can use for a small group discussion session. Now, the second, it's not only the venues, but also the resources. So you need some resources. Yes? You wanted to comment, Abdurrahman? Now, the second part is the resources. You need to make available resources because, as you know, now students mainly use their PowerPoints to learn, and some of them use some handouts, and some of them use library books. Some of them have their own books. You need to make available resources at their fingertips. And this is why we are working on the creation of this digital resources library. And in this year resources library, students can very quickly access resources at their fingertips while they are learning through problems. Now, the third challenge is the teacher. The teachers don't think that training is difficult. Training is not difficult. I think after we finish Saturday's session, all of those who are new to problem-based learning will have the skills to do it. No problem at all. So what is, we need to convince and win teachers from the way they are teaching now, so that they do not convert problem-based learning sessions, problem-based learning tutorials into mini lectures. So the winning is not easy. I went through this uh, journey myself because I was taught in a completely traditional university, and then after that I did my PhD in the University of London, which is also traditional, and I came and started working in Sudan for about 8 years in a traditional environment. So I am used to teaching, teach. When I started adopting problem-based learning, when I joined Imam University, which was about 10 years ago, and before that, when I worked in Sultan Qaboos University, which is about 20 years ago, or 17 years ago. Now, in these two universities, they are using problem-based learning. Now, problem-based learning for me is new because, not because it's a new approach. Getting it, understanding it was easy. But adapting to it, I mean, sitting in a room, listening to students discussing issues, making mistakes, and you do not intervene. This weaning needs effort, needs time. So weaning teachers from what they are used to now, which is teacher-centeredness, it easier said than done. It is easier said than done. So this is one of the challenges. So we need to introduce problem-based learning and peer evaluation at the same time. We need intervention so that we monitor the change from student-centeredness to problem-based learning. The third aspect is the fourth. You said the challenge is the fourth challenge I see is also weaning the students from spoon feeding into student-centered approach. So weaning them should be transitioned gradually. So we need to introduce problem-based learning and student-centeredness gradually so that students gradually adapt to the new approaches. So these are the four main challenges, and they need to be addressed. We are addressing now all of them at the same time, gradually introducing, preparing venues, preparing digital resources, etc. Thank you for raising the issue.
Prof, I have another question, please.
Yes, please, Hassan.
Yeah. In an institute like ours, can we start this problem-based learning straight away, or can we adopt in the form of feasibility study to see whether it is feasible? I know it is feasible, but for us, which we have not done it before, or maybe we are doing it on an individual basis. So how should we approach it? Right away or through phases? And
there is already a change management plan in place. So it is gradual. This is one. We will start with those who are interested to start with. We will start with those who are sort of ready. They have some sort of expertise in the teaching through tutorials. So it is going to be gradual. As you said, it is feasible because the literature is all over the place talking about it and how feasible it is. Not only suitable and beneficial, but it is also feasible. Now, this feasibility, they talked about their experiences. One of the experiences, by the way, was reflected by Professor Carroll when he gave his talk about, and he called it student-centeredness works. And he reflected on a very long experience, how he gradually introduced this student-centeredness. So we might adopt a similar approach in introducing it gradually, provide all the support needed by faculty and students, and then, as you said, evaluate while we continuously improve, and then involve more people and more time. For example, if somebody asks me, I will say, well, introduce 2-3 problems in the first delivery of your course, then later make them 5, and so on. You don't need to make many problems in your course straight away. So not all courses at the same time, and not many problems in the course itself at the same time. If we can move to the process, because very important to know about how it is done.